Do you have chronic pain in your hands and feet that you haven't been able to get rid of? Maybe you've been told you just have to live with it. Well, pain can be so debilitating.
That is the truth, JJ. Well, thankfully, we have a friend joining us, Ashley Pritchard from Summit Integrated Health. She's joining us with a solution, and she's their medical director and board-certified family nurse practitioner. Good to have you back.
Hi. Good to see you guys.
So tell us a little bit about the chronic pain that you treat over at Summit Integrated Health.
Absolutely. So, unfortunately, chronic pain can present in many different ways. One thing that people don't realize, it can actually be a form of neuropathy, which can be related to diabetes, or as we talked about before, different ailments that were led to the neuropathy itself.
It can be tough because pain is like, it's a sensation that you can't ignore, but it can be the result of any number of things. So at what point do you recommend that people come to see you for an evaluation?
Immediately. Any pain is not normal. And I always tell that to my patients. If you're in pain, it's not something that you just deal with every day. And that's the unfortunate side, where pain can get worse and it can lead to handicaps.
Right, and I think so many people, like when the chronic pain hits them, they just panic, right? So in that panic state of mind, what should they do? What are the first steps they need to do?
Call Summit Integrated Health. We'll get you in immediately. We'll get you in for a consultation and exam to see what exactly is going on and where does the pain actually stem from.
Nice.
When it comes to neuropathy, you treat this condition specifically. It often, as we've mentioned, it surfaces in pain in the hands and feet. Is it a nerve pain, or where does it originate?
Absolutely. So neuropathy can present in many different ways. As we've touched base before, it can actually be numbness, pain that feels like almost electrifying, shocks going down into your hands and feet. It can keep you up at night. It can be stemmed from nerve damage, or it can also be stemmed from a traumatic injury that is leading, unfortunately, to damaging of cells and vessels.
Well, you guys have such an amazing reputation at Summit Integrated Health, so what type of solutions do you get to offer?
Absolutely. So anytime that people come in, we do an individualized consultation, exam, x-rays, and report our findings that can then lead to our individualized treatment plans based on what we have found. Whether it's neuropathy pain, how much percentage they have loss from the nerve damage, so that we can do a treatment plan that is minimally invasive and completely non-invasive that actually does not include prescribing medications such as gabapentin, Lyrica, some of the mainstream ones that unfortunately just mask the pain. You're not actually getting to the same root cause and helping the problem. So at Summit Integrated Health, we definitely try to help the problem instead of just masking the symptoms.
I think that's a great approach. Yeah, we don't want people to just be masking the pain because you're not dealing with the source. Ashley, I remember, I think the last time you were on, that you mentioned that it's not possible to completely reverse peripheral neuropathy. It's even hard to say.
Yes, it is.
I know it's even harder to experience, but you are able to oftentimes lessen the symptoms and kind of prevent the progression.
Absolutely. So our goal at Summit Integrated Health is, how can I improve your day-to-day life?
Okay.
Whether it's sleeping better, more soundly, whether it is able to maintain your balance and coordination just from stepping. People don't realize that even going up on a curb, people take that for granted, that don't have these symptoms and don't have these problems. That's huge. We do not want our patients to end up in a wheelchair, even worse, amputations, hospitalizations, and possibly even death from it. How can I help them, even in the smallest bit of improvement, so that their life can get easier, whether it's pain-free, or being able to sleep at night, or even just helping the entire segment of gut health to help with the process of your blood sugar. Anything like that, I am willing to help my patients, and that's what I thrive on.
Very cool. Well, big question, of course, do you accept insurance at where you practice?
Absolutely. We accept about 99% of insurances, and I always say that because some people have a supplemental that's a little different that I haven't even heard of. Some, I think, just come out every day. But I always make sure that I get them verified through our billing team so that we can help the patient, so there's no hidden fees, no hidden costs,
Yep.
anything like that. Everything is upfront for them.
Ashley, thank you so much for joining us.
Thank you again.
We want to mention Summit Integrated Health has 2 locations across Las Vegas. And real quick, a special offer where people can get an evaluation today.
Absolutely. So it is $49 for the first 25 callers. And again, that's going to include consultation, exam, x-rays, and report of findings.
That's incredible. First 25 callers, guys, 702-359-PAIN. That's 7246. Visit summitintegratedhealth.com. 2 locations.